I think the consumer compass has been completely realigned as a result of the mass digital impact that's gone on in the healthcare industry over the course of the last 10 or 15 years. And during the course of the last 5 years, everything is now completely automated or in a great extent automated. So the amount of data that are there for providers, for payers, for the government, and consumers to look at and to analyze and to assess is substantially better and greater than it's ever been before. So I think there's an exciting, if you will, next 5 to 10 years of innovation that's going to occur on top of a digital platform that's out there that's been built. So I think the compass is really now aligned for some success because of the hard work that's gone on for a very long period of time. Harnessing that in through the lens of a consumer, though, is something that people have not spent a lot of time on, in my opinion. And I think that orientation is going to be extraordinarily important to the success of truly bending the cost quality curve here in the United States. And by that I mean as people have access to their own information, as they're being held accountable for their own habits, for they're being held accountable for adherence to protocols, they're being held accountable financially because they're having to pay copays and higher deductibles. I think that's going to create the incentives that we all hear in an overused word in the industry to really get people aligned to do and take a more active role in their own healthcare and their own health. So there's a convergence here, in my opinion, of multiple different items. One is I now have a digital platform and I now have incentives from a consumer standpoint, and you have a lot of people that are actively engaged already, and you'll have more people that will be engaged because they'll be pushed into it. And to the extent that their first experience with that is a positive one, I think this has a lot of promise to be something that's going to be very impactful to this nation. We actually have a mantra inside the company, and it's been a policy and a practice and a part of the culture of having an open, connected community of health is what we try to build. And that's the vision, that's our mission statement. And by that, we have a group of people inside the company of over 40 people whose only job is to help people who are building applications on top of our platforms to help them be successful, to grant them access to the APIs, to grant them access to the training and education, to have them understand what kind of data are available for them to innovate on top of, and to make sure they understand the depth with which they can actually access data versus it just being a CCA or a CCDA, HIE kind of transaction. So we have an investment in people, we have a corporate policy and a practice, and we have a corporate vision of being open. And we think that as part of being an open platform, we'll be able to distinguish ourselves by allowing another 2,000 plus people that are writing code every day, which is the current count of our application development programmers that are out there that are certified, that access our APIs each and every day. I think that there's been a fair amount of discussion around more access to healthcare, and then if that access converts into a feeding frenzy, if you will, where I've not perhaps had access in the past, and now I do, and therefore I'm going to take overuse the benefit that I have. There's that component, but most of the time, where people are really sick or people that are really not doing well against their protocol, they haven't taken full advantage of the offerings that are out there, and that's not been something that has resulted well in their own personal health trajectory, nor has that benefited anyone from a cost standpoint, because they become the sickest, they become the ones that show up at the last minute that could have been potentially an avoidable, that event might have been avoided earlier had there been an intervention early on, or was the disease or the condition they have was at a much lower state of severity.